Hello, my name is Dr. Elftise. I'm a GP in Coventry. I did the Trailblazer Fellowship last year. I applied shortly after finishing my CCT. I did my ST3 year in a practice in a very deprived area, and I have to say, I've before starting it, I wasn't sure that I would manage all the what we say complex cases that we see, but the pleasant surprise was I really enjoyed working in the area. I felt like I make a difference, and when my ST3 year finished, I did some sessions at the local refugee centre, but I felt like I needed to support the learning. I just needed more learning, more support, more time to do other things. And when the fellowship advert came in, I applied and managed to get in. So we started in September 2020. So why enjoy the fellowship? I've enjoyed the learning. We had a monthly National Trailblazer Fellowship Forum where we had a talk from one of the national influencers in the field. So Marmot, Farzana, Hussain, learned about trauma-informed care, adverse childhood experiences. The learning has transformed my way of seeing my patient and understanding my patients. So and it was a chance to meet other trailblazers in the country who are either in the middle or just starting and learning from each other on various projects like managing translation, translating leaflets, managing vaccine hesitancies among certain populations. So that was the national monthly meeting learning. And then it comes to the practice level, the gift of time that this Trailblazer Fellowship gives you for 2 sessions a week. That is your Trailblazer time to do any project that you would like to do, either on a practice level or a place level or a CCG level or a system level. It just the autonomy there is amazing. So we managed to do sessions on or projects on learning disability, annual reviews, cervical screening, opioid deprescribing. One of the things that I came out, I knew that I wasn't good at is managing respiratory conditions. We know respiratory conditions, COPD particularly, is very common in areas of deprivation, and I wanted to learn more about it. So I used my budget. So you get a budget with this fellowship. So this budget, I've used it for an MSc, but some colleagues used it for attending conferences and doing short courses. And that's again part of the autonomy as well as the learning of the fellowship. I managed to attend conferences. One of the organisers of the Midlands-wide Health Inequality Conference last year, and this year I recently was invited by the Royal College of Physicians to talk about the experience of the fellowship. So that's another experience I wouldn't have had without the fellowship. And these are some of the things that I've enjoyed during the fellowship, the time, the sessions that are available to do whatever you want with the autonomy, that to do the projects that comes from usually a consultation or frustration from one thing or another that this fellowship allows you to do. What is after the fellowship? Now the Equality and Diversity and Inclusion Lead for Coventry and Warwickshire Primary Care. I'm continuing with the project, some of the projects that we've started in the fellowship. Mainly, we're developing a learning disability kite mark, working with a local charity as well as with the CCG or the system at the moment, as well as I'm still working with the COPD team at the place level on various projects as well, smoking cessation, pulmonary rehab, virtual ward and spirometry. Yeah, so I highly recommend it. If please try it. Doesn't have to have, you don't have to have any experience before in an area of deprivation, but you might have changed your whole career there with the support of the fellowship and the time that you have. Thank you.